everybody, I am back again with another video. So today I wanted to do something like I said I was going to do in my last video, which is a updated skincare routine. I'm just kind of like updating my other videos that I've done before, and then I'll kind of branch out and do other things. So I have acne prone skin, which is usually pretty oily, and then I also have little dry patches too that I get. So I guess I'd say I have combination skin, but my oily patches are super oily. So all throughout my life it's been like that. I've always had acne prone skin since I was probably like 10 or 11, I guess, is when it started. And it's always been like moderately bad, but not as bad as it's been as it got when I was like 17. It started getting like cystic acne, and that's where these scars on my face, I don't know if you can see, probably not. That's where the scars came from, is when that cystic acne really hit. So that's when I knew I needed to do something different. I needed to go to a dermatologist. So I went to a dermatologist, and you have to make sure that you're finding the right dermatologist, because the wrong dermatologist, as you will hear, can mess up your skin so much worse. So I went, and she's like, okay, well, you don't have scarring acne, and I'll give you these, I think she gave me like a topical cream, and she's like, try this and stop whatever you're doing. Which at that point I was using, what was I using? Oh, I was using Proactiv, which I'd used for like 4 years, I think. No, like 3 or 4, however, a couple of years. So I started using that, and I just noticed that it was getting worse. And of course she said it'd get worse before it got better, which totally fine, totally get it, that's fine. But it just kept getting worse and worse and worse. And I think I used it for, I think maybe like a month. That's how long she wanted me to use it before I came back. And I came back, and she's like, okay, well, you have scarring acne. And I'm like, well, last time you said I didn't, so what did you... She's like, well, now you do. And I was like, okay, well, that doesn't help at all. Like, so I never went back to her. I never went back. And I was like, okay, well, now I have scarring acne. How do I deal with this? So I stopped doing whatever she told me to do, like, instantly. And then I went back on Proactiv for a little while, just to kind of see if that would help clear it up a little bit more. So that did not work, and I started my quest to find more dermatologists. Now, there are so many dermatologists you will find if you ever Google, like, in your local area, like, where your dermatologists are. Mine, I did so much research on dermatologists, I could not even tell you. Like, I looked at reviews, I looked at, like, before and after pictures of, like, their acne treatments, or, like, things like that. Now, I found my dermatologist no, you know what, actually, I didn't find him online. I found him through, a referral. I went to my plastic surgeon and asked who they use for the dermatologist, and that's who they use. So I decided to go there and make an appointment. And at first, he was kind of just, like, very, like, to the point, like, very, like, not very friendly. And I told him what was wrong. Like, he looked at my skin, like, he had, like, his little, like, binocular things and, like, looked into my skin. And, that's kind of, like, how that first little bit went. And he prescribed me, he's like, okay, well, let's try this. He's like, he gave me a topical cream that he makes in his own office. He has, like, a spa and his dermatology practice in, like, one building. And it's 20% benzoyl peroxide. So that's, like, the topical cream he gave me. And then he also prescribed me doxycycline, which is a, what is the word? Like an what is the word? Let me see. I can't think of the word. It's like, I can't think of the word. Oh my gosh. Anyway. And then he also prescribed me spirulactone, which is a hormone. So I was really nervous, because I don't really like taking pills, and especially, like, for my skin. So I tried it out, and at first I didn't really notice anything, just because you're not really going to notice anything right away, and he told me that, and I totally understood that. So months went on, and I noticed my skin clearing up. That was, like, the best feeling ever. Like, I knew once I started using it for a couple months that it was going to work for me. So I went back to follow-ups, he prescribed me the same thing, and I've been using this combination for, let's see, a year and a half at least, I would say, 2 years. So that's been working really well with me. Now there's just a few little like tweaks that I do. So with my Proactiv, when I used that, it was a 3-step. So it was the exfoliator, then the toner, and then the moisturizer. So with this new routine, all I had was the topical cream, and that was it. And I noticed my skin getting like dry and flaky, like I had said before, and because I felt like I wasn't moisturizing it enough. So I went ahead and I purchased the Clarisonic. I think this is just like the Mia 2 or Mia, I don't know. And I got that actually through, where did I get that from? QVC. And it came with like a little pack of like that, and then like replacement heads, and I think I have the sensitive one still on there. I'm not sure. I've only gone through like a couple heads and I don't remember which ones I've purchased. But that I love that thing. It actually is sold in my dermatology office too because he really likes it. So that I use once a day. I use that actually at night when I take my makeup off. So since I am using like a foundation now, I'll use my face wash and then I'll use that to kind of get all the rest off. And that I feel like once a day is good for me. Like I don't want to over exfoliate either. So that has helped with that kind of like problem of having like dry skin, like excess skin almost. So then with the actual dry skin, after I use that Clarisonic, I go ahead and I use the Cetaphil Oil Control Moisturizer, which is really light, which is really nice, and I liked it because it was oil free. And Cetaphil is actually a brand that my dermatologist recommended, and when I went to go, this is a side note, when I went to go get my laser treatments, this is the actual moisturizer that they gave me. So that's where I got this from, or that's where I got the, not this actual one, but like where I got that idea from. And then my actual face wash that I'm using is Cetaphil and the Oil Control. So it's just like a bigger bottle and it's an actual foam. So that, so this face wash doesn't have like any exfoliating agents in it. That's why I need that Clarisonic. So that's kind of like where I'm at right now with all of my acne routines. So what I'll do, like I'll say like in the morning, I'll be in the shower, I'll use my foaming facial wash, and then I will go ahead and put my acne, trying to see if I can show you, I'm not going to show you my information, but like it just this is my acne cream, and it just comes in like a tube like this, and you just open it and then squirt it and then use it. I don't have to use a whole lot, and it's also benzoyl peroxide, which bleaches my things, so I have to I have certain shirts that I use at night that I sleep in, and then also like after I put it on I have to wash my hands to make sure I'm not like touching anything and like bleaching it, because I've done that. And, like all my towels, my like shower towels are all like bleached just because like that stuff is so strong. Anyway, so then at night is when I really do all of my stuff. So like at night like I said, I will get my foaming wash and then I will put that on, and then I'll use my Clarisonic. Ooh, I'm throwing it now. I'll use my Clarisonic, and then that'll get all the excess makeup off. And I'm sorry, before that I'll actually use my makeup remover wipes. I just use like the regular like Neutrogena ones. And then I will go ahead and moisturize. And then I will use my acne cream again. No, I'm sorry. Actually, I put my acne cream on first, and then I put my moisturizer on, because I feel like the acne cream has like a barrier almost. Because if I put too much of this on, my face does get really greasy and it breaks out. So I feel like this is like a good like protecting it. I know that sounds super dumb and it probably makes no sense, but for me it totally does. So that is what I do for that. That is pretty much all. I think really going to a good dermatologist and listening to what he has to say and trying it really changed my whole skin. You have to be so careful when you go to dermatologists because they can mess up your skin so bad. Like I said, I got this pitting acne the cystic acne from going to a dermatologist that did not know what she was doing. So now I have these permanent, and I probably cannot even see this at all, these permanent scars. I can't see them. I'm wearing makeup, but from her not knowing what she was doing. So yeah, that is pretty much it. If you guys have any questions, leave them below. Any advice, any concerns, anything like that, let me know. And thank you guys so much for watching. I'll see you next time. I'll see you guys next time. Bye.